Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I am Emily Jacobson. Today I wanted to talk about options for induction. And I know that's not a topic that everyone wants to talk about, but it's something that does need to be talked about. So here are a few things. For cervical ripening agents, and so that would mean that your cervix is still closed and long and not favorable to start really an induction just yet, you'll need to go in the night before usually, and they would put either Cervidil or Cytotec on your cervix, and that would help soften and get that cervix ready for pitocin in the morning. There are a lot of scenarios. If your water's broken, you could do oral Cytotec, but you would not be able to put anything on your cervix because it would just be washed away if your water had broken. Another option about induction is a Foley catheter or a Foley bulb. And what it is a catheter, and you put it on either side of the cervix, so one inside the cervix, one under the cervix. Both balloons are filled with saline, and it puts pressure on the cervix, just kind of like if you were pinching Play-Doh. Okay, so that is kind of nice because you don't have to be monitored for that. It is a bit uncomfortable, but definitely tolerable. And when you are 4 to 5 centimeters, it just falls out. And so it's a great way, especially for first-time moms or VBACs, to be able to utilize that option before even starting your induction. You're already 4 to 5 centimeters, which is a great place to be. Another option is pitocin, and a lot of people have a lot of fear around pitocin, but it really is up to your provider and how they manage their pitocin. And so normally what we would like to see in a perfect world is starting at a low dose and upping it every 15 to 30 minutes. It takes about 30 minutes to get acclimated with each dose, and the goal is to get contractions to be 2 to 3 minutes apart. So it's not that once they start upping it, they're just going to keep upping it until you explode. I think that's what everyone thinks, especially if you've watched like The Business of Being Born and other movies that kind of give you some scare tactics. But know that it is a really valuable tool that can aid you in having a vaginal birth versus a cesarean surgical birth. So those are just a couple things. So Cervidil, Cytotec, Foley bulb or Foley catheter, and pitocin. There are obviously other things like sweeps, breaking your water, and other things that you can talk to your doctor about, but I wanted to make sure that you guys knew that there are other options than just one way to do it. So it's what works best for you, and that's why we're the experts in options. Have a great day, everyone. We'll see you soon. This has been your Tuesday Talks. Bye.